here to serve you. As a caregiver, often the focus is on the person that had the stroke, but you are just as important. Often people want to help, but they don't know how to help. So don't be afraid to ask for help. Many times family and friends, they want to help, they just don't know how and need to be told. It's kind of like being a parent. No one will love and care for your child like you will, but for a few hours a week, good enough can be just fine. A little bit later, we'll talk about developing a care plan for when you're not able to be with your loved one. You can go to stroke.org and they can help put you with other stroke survivors where you can find caregivers and tips on taking care of your loved one. If you're having difficulty mentally adjusting to some of this, then Singing River also offers a behavioral health group that can help listen to you. Your local pastor can also be a good resource, and you can call 228-696-9224, and they can put you with a counselor if that's the route that you would like to take. They can teach you coping skills that will help you manage this. You can also go to caregiverstress.com and find some more information. Your healthcare providers, from your neurologist to your physician to your physical therapist, occupational therapist, speech therapist, mental health counselor, we're here to serve you, but we can't serve you if we don't know your problems. And knowledge is power, so don't be afraid to ask questions. That's what we're here for. The more you know, the better prepared you are, and the more in control you feel. It is our job to provide education, encouragement, and resource options. Being a caregiver is a really tough job. It's full of on-the-job training and very little break times. However, just like in an airplane, you must take care of yourself first, or you will have little left over to give to your loved ones. Please feel free to prioritize your time and delegate. Lists are wonderful, and put yourself on the list to take care of. There's many tools out there that can help you, from online grocery shopping, Walmart.com, Amazon. You can have stuff delivered directly to your door where you don't have to go out in the community. Talk with your doctor, because there can be a time for respite care. There's other resources that are available to you to help. You can also go to respite.org to find out more information. From stroke.org, here are practical tools and emotional support. You can find tips for daily living and the library. It's a volunteer-powered library to gather tips and ideas for what might work for you. There's also home health. The therapists and nurses there are here to help you. Tell them what you're having problems with, and they can brainstorm to find easier ways to accomplish similar tasks. After your loved one has had a stroke, this is the new normal. Life may change, it's changed in a big way, but it can continue to get better. But you'll need to adjust to the new normal. So you can talk about with other stroke caregivers and newsletters to find more information. At stroke.org, the Caregiver Resources help. They have a discharge checklist, a caregiver guide to strokes, and daily home care. There's also a family warm line to put you in touch with other family members that have had strokes. Here's 7 practical tips for self-care. Because a caregiver's life is packed with taking care of not only themselves, but their loved ones in the house. You have grooming, doctor and therapy appointments, exercises, food preparation, all even that before noon. That's not including the rest of the day. Caregivers can experience exhaustion, depression, and burnout. And when that occurs, that's not good for you or for your loved ones. Any advice on how to handle the job, sometimes when people give you advice, you roll your eyes. But take time to listen, because you might glean little nuggets of help from there. How do you eat an elephant? One bite at a time. You don't have to do everything at one time. There's 7 days in a week. Make sure you get plenty of rest. If you don't sleep well and you don't rest, you're grouchy and irritable, and that's not good for everybody. Sometimes just taking a walk and getting out in nature in the sunlight can help you. It's important to eat a healthy diet for your immune system and so you don't have low blood sugars. Make sure you get out and do things you enjoy. Put yourself on the list of calendar of things to do. When life is busy, it can be challenging to find time for anything of yourself. I know as a single mom of 3 kids, it's essential that I pre-make my meals. I have a day on Sunday that I cut up my food. Using a pill organizer is essential. As you've had a stroke, the medications to prevent another stroke can seem daunting. And that can shave about 10 minutes off your day just by taking 30 minutes once a week to make those pills into their daily time, so you don't have to think about what time it needs to be given. I live by list, and I love to check things off my list and just cross it off to know I've done it. But make yourself a priority. That way you don't have to forget what you're doing. And if you have a smartphone, you can keep a rolling memo pad to ask your healthcare providers or your physicians questions that you don't want to forget. Staying focused on what's important to you. Make the one big thing the one big thing, and to keep you happy. Set a time limit on tasks so you don't get too involved and forget about other things you need to do. Preparing a care plan. It can be time consuming, but when you have to leave your loved one with someone else, it can help a lot. You don't have to worry that something's not going to get done. So just say yes. Sometimes the hardest part can be people want to ask you for help, and let them help. As a parent, we know that we're going to love our kids the best and that no one else will love them the same. It's the same for our parents. But it's okay. It doesn't have to be perfect all the time. Sometimes good enough is just okay for 2 times a week, just to give you a break and get some help. Here's some local resources along the Mississippi Gulf Coast. Care and Home Health, their phone number is 604-4550, and they can come to your your home for 2 hours a week for $45. And they can help take care of your loved one. Some have minimums, some have maximums. Some have to have it twice a week, but here's a list of resources from PRN Home Care, Home Instead, Prada Home Care, and Amada Senior Care. Reach out to those that can help you. Again, this is our comprehensive rehab, CRC, up on the 4th floor at Singing River Hospital. And this is our stroke support group that we have once a month on the 2nd Wednesday at 10 o'clock. Here's our calendar for our next 6 months of topics. We would love to hear from you to see what you'd like for us to present. And now with this COVID pandemic, it's reaching new heights. And if you're over the age of 75, you're now eligible for the vaccination. Please schedule an appointment at 809-5555 to call and get your appointment. So be smart and stay apart. Isolate if you are ill. If you have any symptoms or you feel sick, don't go around anyone else. Wash your hands. You stay healthy. Eat healthy. Remember, if you love them, don't hug them. Keep your distance. Observe the 6 feet. Wear the mask. And shop local from your house and have things delivered. Please stay smart and stay apart. This is Singing River Health System Stroke Support Group. We would love to hear from you. Thank you for your time and attention.